Gosh, I have so much respect for healthcare providers. And yeah, this situation was just such a poor example of how healthcare professionals can actually be. My name is Jessica Corwin. I am a wife, mom of three young kids, a registered dietitian specializing in midlife and menopause. And it was interesting with each pregnancy, actually each stressful event in my life, I started to notice little symptoms of things showing up, right? I remember I think I was with my bridesmaids, and my maid of honor was like, "Hey, what's that on your elbow?" Right? And I'm like, "Huh, I don't know, dry skin. Let me get some lotion. It's fine." Right? And kind of blew it off and had never really thought about that again. And then when I was pregnant with my first, I started noticing other weird skin issues coming up. I was like, What is this?" My second, same thing. And then my third, I had so many more patches, and I was also having other weird symptoms. And of course, right, as when you're a new mom, there's so many things going on. And I know a friend recently phrased it as like we are number 11 on that top 10 scale, right? Like we don't put ourselves anywhere on that. So I just kept blowing it off, blowing it off. And yeah, it looked like real dry, scaly skin. I mean, it's ugly, right? It's not the coolest thing. And I had patches forming on my ankles, knees, elbows, and my worst ones were always on my tailbone. And honestly, that's where it would start bleeding if I didn't like keep lotion on it or keep something else. And I really just I thought it was maybe just something of pregnancy. So I just kept blowing it off because that's the time it was flaring up for me. And then it would kind of dissipate and go away. So I kept thinking I could just ride this out, try to buy all the most like sensitive skin lotions, take care of it. And yeah, it was just strange. After having my third, I remember, so I had probably a 1 and a 3-year-old, and then my daughter, who was, I don't know, a few months old. I remember walking out into the kitchen carrying a mug, just like this. And I remember it just fell out of my hand. Like I just lost control of my hand. And I had felt that with my feet at times. So it was just the strangest thing. And of course, then I have this huge mess. I'm home alone with three tiny kids, right? I had postpartum anxiety also, so I just felt like such a hot mess trying to clean that up. But I think that scared me because I just felt like postpartum already it feels at times that your body's betraying you, right? Like you look different, you feel different, everything's so crazy. And then just to have like lose control of my hand was just, I guess, the last straw. And it kind of woke me up and was my wake up call like, hey, I need to figure out what's going on. I should probably call the doctor. Then I was referred over to this psoriasis specialist. And gosh, I have so much respect for healthcare providers. And yeah, this situation was just such a poor example of how healthcare professionals can actually be. She starts asking me all these symptoms of things that I was experiencing, telling me, she's like, yeah, absolutely, this is psoriasis. And she's like, this is specifically psoriatic arthritis because I was having the hand and the feet issues. And there's not really a true test to tell you if you have that. So she's just right away jumping the gun. She's like, yep, you have these symptoms. You have psoriatic arthritis. You need to start steroids right away. Let me write you a prescription. And I was like, oh, I'm actually still breastfeeding. And she's like, okay, you need to quit and start this medication. And at the time, I was working on this incredible health education team where I was working with breastfeeding support groups, teaching prenatal health, like teaching baby led weaning in this class, Nourish and Play, right? So I knew all the things for what's important for my baby. And yet she's just like, nope, you need to stop that. So, of course, so many red flags are going up for me. And I told her, I'm like, well, I'm a dietitian. So maybe there's some lifestyle options that I could try, right? And she's just like, she kind of laughs that off, right? She's just like, no, that is not a choice. Like there's no evidence behind that. Like you need to just start this medication. And basically by the end of this conversation, she made me feel that if I didn't just take her advice then and there, I was going to become a burden on my family and I wouldn't be able to be independent and support myself. And of course, I'm already emotional, right? Just had a baby, had postpartum anxiety, all the things. I'm just pouring down tears walking out of there. I went home, cried on my husband, and finally I realized, you know what? I am not a victim. I have a choice in this situation. And I started doing a heck of a lot of research and I found all of these one-off situations where people did have luck with lifestyle and diet, right? So I sought out a functional medicine practitioner and she was like, of course, I would love to help you figure this out, right? Like, you don't need to do steroids. Let's try this first, right? And I don't know, it was very empowering, but also terrifying because who wants to think they're going to become a burden on anybody? Oh, and as a health professional myself, right? And I feel like I know diet and nutrition. So I'm like, oh, I'm willing to do the work. I can, what about trying this? And even that, like I felt so small in that situation. I just made the thing like, oh yeah, I'm stupid. I shouldn't have suggested that. Like why would I have suggested that, right? I don't know. It was just horrible bedside manner, right? Of just blowing someone off. And I've thankfully, I mean, that was a very humbling, like grateful, a learning experience for me where I am grateful in hindsight because it's taught me so much about what it feels like to be on the other side of that conversation. And same going forward, I was put on an elimination diet, and that was so hard. So, same thing. Now, if I'm working with a woman who needs to try or wants to try an elimination diet, I have so much more compassion and empathy for what that feels like. And I know to offer her a menu of options, right? Like, okay, like we could go all the way up to this level, or we could just start here with just one or two things, right? Like these are the biggest culprits. You want to, what feels right for you? Oh yeah, and I love the functional medicine doctor. She had actually just broken off from a more conventional practice and was starting her own functional medicine practice. And so I was one of her early patients. And so I give that credit to, I was paired with her dietitian too. And so I also was one of her very first patients, and also giving credit that with psoriatic arthritis, with skin issues, an elimination diet's so tricky because it's not like a immediate symptom you're going to see, right? So I ended up being put on this very strict elimination diet for, gosh, maybe 6 months. Whereas a lot of times those elimination diets are intended to be so short, but because it was a skin and joint issue, I don't know, it was kind of tricky. So in hindsight, I don't know that it needed to be that long. But also, I was just handed this list of all of these foods and ingredients that I didn't even know a lot of the ingredients because some of them are just like the random fillers. I mean, I've seen them on labels, but I couldn't tell you what they did or what they were, and yet suddenly I had to avoid them. So I wasn't given recipes, right, or meal plan or anything like that. And not that I think that's always the answer, but it was just so overwhelming. I was only shown like, don't eat these things, right? So then I basically had to, just cook from scratch. I had to eat real uniquely for the next 6 months. My friends were like baffled, like, okay, I would like to help you. I don't even know what you're allowed to eat right now. Yeah, it was just really, really tricky. And I have ended up avoiding, I didn't stick with the super long list after that 6 months, right? I started to bring things back in. For the longest time, I thought dairy still was a trigger, but ultimately, I have found I really only need to avoid gluten to keep my skin in check as long as I manage stress. Stress is also a big trigger. And also, really sugary foods flare up all my joints. I feel that. And perhaps out of the nightshades, tomatoes are a bigger one, but it was just still that list in itself, right? I mean, like every processed food, like even canned food, like everything was just taken off the table. So it was just it was so challenging and it just taught me so much. I mean, food is so much more than calories and nutrition, right? Food is our connection, it's memories, it's tradition. So suddenly to be pulled away from all of those things, it was just so isolating And yet I could also see this is temporary. This is keeping me away from needing the steroids. So it was just this, um, I don't even know the word I'm looking for, right? It was good and bad. I could see the silver lining, and yet I could also see it was rather damaging and isolating. Yeah, it seems like yeah, I do. I love, I tend to stick with goat milk overall, but I do love like goat milk kefir, and it seems like even regular, like whole milk kefir, I can do from a cow as well. I just try to limit it, but it seems like the fermented dairy is just fine, right? Like those things I can tolerate. I do really try to be strict about gluten. Once in a while, you can't avoid it. I mean, we have to eat, and sometimes there's just no options, right? When you're traveling or whatever the case might be. And in those cases, I just do my best, right, to just not have too much of it. And I always see a flare up right after that. But those little instances, like I can handle that, right? And I know, if you just continue to, because I did have one time where I'm like, you know what, this is all probably BS. And I was just over it. And I'm like, I can't live like this. I don't want to do this. So I had just brought a lot of things back in. And then I had all my symptoms showing right back up, right? So it was just a wake up call that, yes, this is important, right? And it makes it actually, that has made it so much easier to stick with this because it makes me feel better. And I'm sure long term wise, the more I can keep inflammation at bay, it's only going to serve me. And it's so funny because my first job as a dietitian, I was teaching people about gluten-free diets. And at the time I thought it was just such a fad, right? Such a trend. So I'm like, okay, here you go. But really it's only for people with celiac disease because this isn't actually a thing that you need to worry about. Um, and comes to find out, right, that there are many of us who are sensitive or intolerant to gluten. And it's simply, it has these little proteins in there, right? It's a protein itself, and it causes inflammation within our gut lining. So it's very interesting. If your gut's already more permeable, what people refer to as leaky gut, this gluten can increase that permeability and get into your bloodstream, cause more inflammation, and create dysbiosis in your gut. So by avoiding that, right, it prevents you from getting into that inflammatory cascade. And what's interesting is not only during times of severe stress, right, or pregnancy, that gut becomes more permeable in those situations. So that's why I was able to tolerate, I was able to at least get by with gluten, between pregnancies. But during pregnancy, I had so much so much more stress in my body. So hence I was getting more of those flare ups. And same going into perimenopause, a lot of women are suddenly diagnosed with autoimmune conditions all over again because, yet again, as estrogen's going down, that gut lining can again become more permeable. I think that's this message is one of the reasons I was excited to have this conversation with you with Her Health Voice, because I believe women are the true experts of our own bodies, right? We live in our body 24/7, 365, and yet far too often we are made to second guess what we actually know to be true, or are gaslit, as more trendy term there. So I really wanted to share my experience to help other women feel seen, be brave enough to advocate for themselves, and remind other women too that asking for help is not a sign of weakness, that it's actually wisdom, right? And it's brave. As hard as that can feel in the moment, it is empowering in itself.